my name is Sarah Vanderwerf, and my group members were Rachel Covey and McKenna Gorslin. And we chose to do appendicitis because it's pretty common around here. But before we start, just by like a show of hands, have any of you guys got your appendix removed or had an appendicitis attack? Nobody?
That's pretty good.
I think there'd be at least one. Okay, maybe it's not as common. Okay, to start off with, we're just going to talk a little bit about the appendix. So the appendix is a small tube-shaped structure right at the tip of your large intestine. It's about 4 inches long. You can see it on the picture right here. Pretty tiny, but it's there. It doesn't really have like a really known function to this day, and if you get it surgically removed, it doesn't really cause you any harm. So it doesn't really have a main function, but it does have a little bit of some smaller functions, like it helps filter the contents from your intestines. But sometimes the content in your intestines can be kind of like icky and full of foreign objects, so it can cause blockage into the appendix, which eventually will cause an appendicitis attack. So some of the causes of your blockage, the appendix becomes inflamed, the entrance, which will lead to an infection. So you can, okay, so here we go. So here's a little closer up picture of the appendix. You can see there's a foreign object that got into there that's blocking the opening, causing it to be infected and grow a bacteria in it. Some common things that could block the opening, this could be a hard mass of feces, a foreign body, a fibrous disease of the intestine wall, a parasite, or the appendix can simply just twist in a weird way if you move your body kind of weird, making it block. So if blockage occurs in the appendix, bacteria held within the appendix becomes to be inflamed and unsatisfied, quickly multiplying to make the appendix swollen and filled with pus. This can cause pain, and if it's not treated right away, it can cause some complications. Okay, so some symptoms that your appendix is blocked, it's sudden pain. There's sudden pain on the right side of your abdomen, that's where most of your pain is, but pain usually begins around your navel under it. The pain when your appendix starts to get infected, it's pretty dull, kind of mild, comes in cramps. You don't really notice it, maybe just like a bad stomach ache. But as time goes on, it eventually starts to hurt pretty bad. Some of the common pain could be just nausea, vomiting, loss of appetite, fever, and chills, and pretty much any pain with movement, it just hurts. Any type of movement you do is not good. So like I said earlier, it's a dull pain to start, but as time progresses, it's going to be pretty sharp and severe, and you're not going to want to do anything because it hurts that bad. So if you eventually decide to go into the doctor, they're going to diagnose you with appendicitis. In order to diagnose this, the doctor is probably going to give you a physical exam. They'll palpate your abdomen to look for abdominal rigidity in just any painful areas. There's also a couple tests they could do to diagnose you. The first one is a blood test. They'll just do a routine lab draw and look for an elevated high white blood cell count. That is an indicator for appendicitis. They can also do a urinary test because a UTI infection gives similar symptoms as appendicitis, so they always check for a UTI first before they diagnose you with appendicitis, just to make sure they're not getting them mixed up. And then finally, they would do like an imaging test. A common one is an ultrasound of the abdomen. This shows if your appendix is swollen. And then for treatment, if it's caught early enough, you could use antibiotics to try to treat the infection, but typically it's used with surgery called an appendectomy. There's 2 types. The first type is a minimally invasive laparoscopic procedure. That's what the picture is showing. There's just like 3 instruments used, 2 of them are cutting devices, and another one is a camera, so the doctors can just cut out your appendix. This surgery is pretty low-key. You can go back to work after a week or so. The second procedure is like an actual physical surgery. If your appendix is far enough along with infection, the doctors will make an incision like 2 to 4 inches in your abdomen to remove your appendix. And then if your appendix ruptures, which it can if you go too long without having it be treated, they really need to clean out your abdominal cavity, because if your appendix ruptures, it has a bunch of infection and pus in there, and you don't want that hanging out in your stomach. So it's important to wash out your abdominal cavity. And then for prognosis and follow-up, typically you're 1 to 2 days in the hospital just on observation to make sure no infection is developing. Again, if your appendix ruptures, your room needs to be drained often and cleaned out because infection is really high after it ruptures. You're going to be on continual antibiotics, and then typically there's a follow-up doctor's appointment after a week or so to make sure things are going good. And these are our URLs. Questions?
Any questions? We'll take a moment for questions after each talk, and then we'll do the next one.